The role of a dental assistant includes efficient chairside technique between the assistant and the practitioner. To facilitate the passing of instruments during a procedure, the assistant must provide a tray that is the correct size, is sterile, includes the necessary instruments, and has the instruments arranged in the proper order. The spacing and arranging of the instruments on the tray can enhance or impede the progress of a procedure. By knowing the exact location of every instrument, you will increase efficiency and reduce stress. Since you have already learned the names and functions of the instruments used in a multiple extraction, as well as sterile technique, this program will focus on setting up the multiple extraction tray while maintaining a sterile field. At the end of this program, you will be able to set up a multiple extraction tray with the instruments organized to save time, motion, and space. The tray setup begins with the selection of the proper size tray. For a multiple extraction, the tray used is a 12 by 18 inch metal tray. Here at the University of Texas Dental Branch, the tray and instruments are prepared for you at the dispensary. When you present your requisition to the dispensary assistant, she will select the tray, materials, and the surgical pack required for the procedure, as well as any specially requested items. For a multiple extraction, the dispensary will prepare the following: a 12 by 18 inch metal tray with sterile covering, a saline cup with bulb, anesthetic syringe and carpules, cotton swabs, 2x2s, and suture material. A sterile towel is placed over these items to prevent contamination, and the forceps packages and surgical pack are placed on top of the tray cover. Also placed in this area are the surgical gloves, mask, cap, scrub pack and towels, post-operative instructions, and the specimen bottle. For demonstration purposes, we will be using specially colored towels which have one white side and one green side to help you distinguish between the sterile and contaminated sides of the towels. The white side will be contaminated and the green side sterile. As you can see, the outside surface of the towel cover is contaminated, but everything underneath remains sterile. Before turning to the process of setting up the tray, let's look at the features of a correctly organized tray. Notice the space between the instruments. Sufficient space allows for ease in picking up and replacing. Notice that the instruments are placed beak to handle to conserve space, and the instruments are grouped in logical collections. In the upper half of the tray are the saline cup and bulb, emesis basin, anesthetic syringe, and carpules, 2x2s. In the lower half of the tray are the surgical instruments. When the tray is organized in this manner, the assistant knows where every instrument is located and can quickly reach for and replace any instrument without wasting time to look for a needed instrument. Now that you know what an efficient tray setup looks like, let's begin the tray setup by picking up the surgical pack, forceps packages, and sterile gloves and setting them aside. Now grasp the tray cover by the uppermost corners and remove the tray cover without touching anything on the tray. You should drape the tray cover sterile side up across the patient's chest and secure with the neck chain. Now pick up the surgical pack. Hold it away from the tray and break the seal. With your free hand, peel back the toweling. Pull the towel back from underneath and expose the sterile inner towel. Without letting the contaminated towel touch the tray, slide the inner pack onto the tray. Drape the towel over the aspirator bottle to shield the contents from the patient's view. Open each of the forceps packages and let the forceps fall out onto the tray. Be careful not to let the package touch the tray because the package is contaminated. At this point, you should go scrub and put on the surgical gloves, mask, and cap. Once you are wearing your gloves, you may touch anything on the tray, but be careful not to touch a contaminated surface. Resume the setting up by placing the forceps in the lower middle portion of the tray. Next, pick up the surgical pack and remove the towel covering to uncover the emesis basin containing the instruments. Set the towel covering aside. Pick up the 2 sterile towels and locate the 2 towel clips. Use one towel to drape the patient's head and the other for his chest. Secure the towels using the towel clips. After draping the patient, return to the tray. To avoid cutting yourself while picking up an instrument, empty the contents of the emesis basin onto an area in the middle of the tray and set the emesis basin in the upper right-hand corner of the tray. This area containing the emesis basin is designated as the dead space. Contaminated materials, such as 2x2s, are placed here. The exact order of the remaining steps is not fixed. What is important is the final organization of the instruments. Thus, the following sequence is only one of many possible ways to set the tray. As you recall, in operative dentistry, the instruments are arranged in order of use. For surgical procedures, they are arranged according to size and shape. Let's begin by looking for the light handle. Attach it to the light. Now locate the aspirator handle, tip, and stellette. Place the stellette to the extreme left of the tray. Connect the aspirator handle and tip, and then attach it to the rubber tubing of the aspirator. Secure the aspirator handle to the sterile drape on the patient's towel using the towel clip. Next, place the 2x2s, the anesthetic syringe and carpules, and the cotton swabs between the emesis basin and the saline cup and bulb. Open one 2x2 and place it in front of the covered area of the emesis basin. Specimens are to be placed in this area. Surgical trays, like operative trays, are set up from left to right, beginning with the basic 3. In surgical procedures, the basic 3 are the mirror, the cotton pliers, and the periosteal elevator. Begin placing them on the left-hand side of the tray. After the basic 3, the rest of the instruments are set up according to size and shape. They fall into 3 groups: straight instruments, forceps, and instruments with handles. The straight instruments will be placed in between the basic 3 and the forceps. These include the retractor, the double-ended curette, the bone file, and the 2 elevators, number 34 and number 301. To the right of the forceps, we will place the instruments with handles: the curved mosquito hemostat, the rongeur, the Dean scissors, the needle holder, and last, the suture materials. Be sure to place these instruments beak to handle to conserve space. When all of the instruments are in place, open the scalpel blade and attach the blade to the scalpel handle using the needle holder. Place the scalpel to the far left of the lower half of the tray. In this way, you will avoid inadvertently touching the blade. Open the suture material and locate the needle. Attach the needle to the needle holder. Do not remove the suture material from the pack. Replace the suture material and the needle holder to their positions at the far right of the tray. This completes the tray setup. As you can see, the tray is now organized so that there is adequate space between the instruments. Each instrument is accessible and the instruments are logically grouped. By setting up the multiple extraction tray in this manner, you know exactly where each instrument is located. Organization is the foundation for efficient chairside technique. Let's review the organization of the instruments on the tray. The tray is divided into 6 designated areas. The basic 3 are placed in the lower left portion of the tray. To the right of the basic 3, place the straight instruments, the forceps, and the instruments with handles. At the far left side of the tray, place the scalpel and the stilette. The upper half of the tray contains the saline cup and bulb, the anesthetic syringe and carpules, the 2x2s, the emesis basin, and the designated area for the specimen. Not only is an efficient tray setup helpful to the dental assistant, it saves time, energy, and reduces the stress of the dental team.